Good morning. The subcommittee will come to order. Today we meet to mark up a total of 7 bills, all of which were discussed at previous subcommittee legislative hearings and all of which have my full support. In accordance with committee rules, the subcommittee has reached out to the Congressional Budget Office seeking informal preliminary cost estimates for each of the bills being considered this morning. It's my intention to forward these measures to the full committee with the understanding that all estimated costs will be fully offset during a future full committee markup when and if they're advanced today. And in the interest of time, I'll now yield to Ranking Member Brownlee for any opening comments she may have. Well, thank you. I'll now call up H.R. 353, the Veterans Access to Hearing Health Act of 2015. The clerk shall report.
H.R. 353, to amend Title 38 United States Code to include licensed hearing aid specialists as eligible for appointment in the Veterans Health Administration of the Department of Veterans Affairs.
The bill was circulated in advance pursuant to committee rules, and without objection, the first reading is dispensed with, and the bill is open to amendment at any point. I have an amendment in the nature of a substitute to H.R. 353 at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 353 offered by Mr. Benishek of Michigan.
I ask unanimous consent that the formal reading of the amendment in the nature of the substitute be dispensed with. My amendment in the nature of a substitute authorized the VA to hire and to prescribe qualifications for hearing aid specialists in consultation with veteran service organizations, stakeholders, and industry groups. It would also require the VA to update the Audiology and Speech Language Pathology Handbook to stipulate that a hearing aid specialist may only perform services consistent with their state licensure as part of a treatment plan developed by an audiologist, and that VA medical facilities must ensure that veterans are given access to the full range of professional services provided by an audiologist. The amendment in the nature of a substitute would also require VA to submit an annual report on whether veterans receive timely access to hearing health services through the VA and on VA's policies with respect to providing hearing health services through community providers. Since this amendment was noticed on Wednesday morning, we have heard feedback from some stakeholders regarding the need to ensure that this language encompasses hearing health services provided by hearing aid specialists, audiologists, and other hearing health professionals. I will continue to work with those stakeholders as we move toward full committee markup to ensure that their concerns are adequately addressed. Do any members wish to comment on the amendment in the nature of a substitute to H.R. 353? Hearing none, and since no other amendments were timely filed, the question now occurs on the amendment in the nature of a substitute to H.R. 353. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute to H.R. 353 is agreed to. Since no other amendments were timely filed, the question now occurs on the passage of H.R. 353 as amended. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. I now recognize Ms. Brownlee for a motion on forwarding 353, H.R. 353 as amendment.
Mr. Chairman, I move that H.R. 353 as amended be forwarded favorably to the full committee.
All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 353 as amended is forwarded favorably to the full committee. I now call up H.R. 3471, the Veterans Mobility Safety Act of 2015. The clerk shall report.
H.R. 3471, to amend Title 38 United States Code to make certain improvements in the provision of automobiles and adaptive equipment by the Department
of Veterans. The bill was circulated in advance pursuant to committee rules, and without objection, the first reading is dispensed with, and the bill is open to amendment at any point. I have an amendment in the nature of a substitute to H.R. 3471 at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 3471 offered by Mr. Benishek of Michigan.
I ask unanimous consent that the formal reading of the amendment in the nature of a substitute be dispensed with. My amendment in the nature of a substitute would direct the VA to ensure that an eligible disabled veteran who has been provided with an automobile or other conveyance is given the opportunity to make personal selections related to that automobile or other conveyance. It would also require the VA, in consultation with the veteran service organizations, the National Highway Transportation Administration, industry representatives, manufacturers of automobile adaptive equipment, and other entities with relevant expertise to develop a comprehensive policy regarding quality standards for providers who provide modification services to veterans under the Automobile Adaptive Equipment Program. The amendment would also require the VA to update the Automobile Adaptive Equipment Program handbook to reflect the new comprehensive policy and to submit biannual reports on implementation and compliance. Since this language was noticed on Wednesday morning, some stakeholders have expressed concern regarding the potential for this language to prohibit veterans, particularly those having in-home installation of automobile adaptive equipment. That is most certainly not the intent of the language, and I will work with those stakeholders and the bill sponsor. Concerns have also been raised about a need for the conflict of interest provisions in this legislation that may need to be strengthened. I'm also committed to addressing that concern and ensuring that this policy is developed and implemented fairly, transparently, and with the appropriate safeguards in place to move ahead to full committee. Do any members wish to comment? Ms. Brownlee.
Yeah, thank you, Mr. Chairman, and I'll be brief here, but I would like to make a few comments. Veteran Affairs should develop a comprehensive policy regarding quality standards for providers who provide modification services to veterans under the Automobile Adaptive Equipment Program. The current policy is clearly, to me, outdated and has been neglected for many years. As a committee, we have listened, I think, very well to the stakeholders and have made many modifications to the bill to ensure that the views of all stakeholders are heard. Our highest priority should be ensuring the safety of the veterans who use these benefits. Strong oversight of this legislation is needed, and this committee will provide that to ensure that all veterans who need the adaptive mobility services are taken care of. I understand that the Disabled American Veterans and the Paralyzed Veterans of America support the bill, and I look forward to working together to improve the bill as it moves forward in the legislative process, and I thank you for that opportunity.
Oh, sure. Well, yeah. Dr. Ruiz?
Thank you, Mr. Chairman. We all understand that the current standards or lack of standards poses a big threat to our veterans who use modified automobiles. And there has been some stories where there has been some faults in the electrical workings of these automobiles, and they can catch fire, and the veterans that are in their wheelchairs are stuck, etc. And so one of my concerns about the amendment is that there's an attempt to make more laxity to accommodate the circumstance of the where the veteran lives, for example. But we got to be careful that we don't reduce those high standards that we want to keep our veterans safe to begin with. If we start to say, well, you know, you can call your friend to come fix, you know, your automobile, or make it as personally adapted as possible, your neighbor, or someone who's not credentialed, who doesn't follow the same rules, who is not certified in whatever way the committee wants to be certified, then we don't really have standards. So the whole purpose of this bill, which I'm an original co-sponsor, is to maintain a uniform high standard of safety for all of our veterans who require these adaptive automobiles. So I'm looking forward to addressing these issues with this amendment and the underlying bill with you to ensure that we maintain the highest safety standards for our veterans who utilize these automobiles.
Well, I certainly agree that it needs to be safe, so I'm sure we can address the concerns that you're raising here today as we move forward.
Thank you.
Anyone else want to comment? Well, hearing no further comments, and since no other amendments were timely filed, the question now occurs on the amendment in the nature of a substitute to H.R. 3471. All those in favor say aye. All those opposed say no. The ayes have it, and the amendment in the nature of a substitute to H.R. 3471 is agreed to. Since no other amendments were timely filed, the question now occurs on the passage of H.R. 3471 as amended. All those in favor say aye.
Aye.
All those opposed say no. The ayes have it. I now recognize Ms. Brownlee for a motion on forwarding H.R. 3471 as amended.
Mr. Chairman, I move that the bill H.R. 3471 as amended be forwarded favorably to the full committee.
All those in favor say aye. All those opposed say no. The ayes have it, and H.R. 3471 as amended is forwarded favorably to the full committee. I now call up H.R. 3974, the Grow Our Own Directive, Physician Assistant Employment and Education Act of 2015. The clerk shall report.
H.R. 3974, to require the Secretary of Veterans Affairs to carry out a pilot program to provide educational assistance to certain former
The
members.
bill was circulated in advance pursuant to committee rules, and without objection, the first reading is dispensed with, and the bill is open for amendment at any point. Do any members wish to offer an amendment to this bill? Ms. Custer.
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
The clerk shall report.
Amendment in the nature of a substitute to H.R. 3974, offered by Ms. Custer of New Hampshire.
I ask unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. The gentlewoman from New Hampshire is now recognized for 5 minutes to speak in support of her amendment in the nature of a substitute.
Thank you, Chairman Benachek, and to the committee for taking up this bill today. As I testified last week, H.R. 3974, the Grow Our Own Directive, Physician Assistant Employment and Education Act of 2015, will allow us to merge our efforts at improving veterans' access to health care and creating opportunities for veteran education and employment. In order to reduce costs and ensure the best chance that this program can be realized, I have introduced this amendment in the nature of a substitute that narrows the focus of the bill to the scholarship pilot program and its related administrative positions. As a result of this ANS, we would create a pilot program to provide educational assistance to qualifying veterans for education and training as VA physician assistants. A veteran would qualify for this program who has medical or military health experience gained while serving in the armed forces, has received a certificate, associate's degree, baccalaureate degree, master's degree, or post-baccalaureate training in a science relating to healthcare, has participated in the delivery of healthcare services or related medical services, and does not have a doctorate in medicine, osteopathy, or dentistry. Eligible veterans would be able to apply during the 5-year pilot program to receive one of 35 scholarships available each year to cover the costs of obtaining a master's degree in physician assistant studies or a similar master's degree. Selection would be prioritized for those veterans that participated in an earlier veteran recruitment program known as the Intermediate Care Technician Pilot Program, and those veterans agreeing to be employed by the VHA in a community that is medically underserved and in a state with a significant veteran population. Those veterans that use the program would then owe the VA a period of obligated service based either on the scholarship program used or 3 years. To ensure that veterans are prepared to succeed, participants will be paired with a mentor at their facility, and the VA shall partner with institutions of higher learning to guarantee physician assistant educational seats. Additionally, this would create a deputy director for education and career development of physician assistants and a deputy director of recruitment and retention within the Office of Physician Assistant Services to the VHA. These individuals would be employees of the VA, veterans themselves, and responsible for executing the pilot program. In a time of shortages for primary care providers, both in the private sector and in the VA, and with the Office of Inspector General listing physician assistants as one of the VA's top 5 occupations with the largest staffing shortages, creating a pathway for opportunity for our veterans to fill that gap and continue to serve their country is an excellent opportunity. Thank you again to the committee for considering this legislation today. I encourage all of my colleagues to support sending this bill to the full committee, and I yield back the remainder of my time.
Thank you,
Less than 5 minutes.
Good job. Dr. Rowe, you have a
I'm going to use the rest of it up. The question I have is once we're out in 5 years at college, we want to make sure that tuition goes on. Somebody gets it in the 5th year. In other words, that runs in, we've run into these roadblocks in doing the GME credits. Make sure that the college knows that that's going to be 6 years paid or whatever. Do you follow me?
I do.
And number 2 is the only, look, I totally support this bill, but the one thing I'm a little reluctant to do is support 2 more positions for the VA to manage something. Surely to goodness, with all the people they have at the VA, in the GME and so forth, they could manage 175 people getting into that program. That's my only concern, is hiring 2 more people. And then making sure that someone who gets a scholarship in the 5th year, it's funded on out through 6 years or whatever the completion date is. We need to make sure that's clear. Does anybody else have that concern of adding more layers of bureaucracy? Because they have a department now that does GME, that does graduate medical education. It's there, it's set up. So I just pose that question. Maybe we could work on that between now. I'm supportive of the bill, but work on those 2 issues between now and the time it comes to the full committee.
Absolutely. I'm happy to look into it.
Okay, I yield back.
Thank you.
Thank you, Dr. Rowe. Any other comments? I will be supporting this amendment.
Thank you.
Hearing none, since there are no other amendments timely filed, the question now occurs on the amendment in the nature of a substitute to H.R. 3974. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 3974 is agreed to. Since no other amendments were timely filed, the question now occurs on the passage of H.R. 3974 as amended. All those in favor say aye.
Aye.
All those opposed say no. The ayes have it. I now recognize Ms. Brownlee for a motion on forwarding H.R. 3974 as amended.
I move that the bill, H.R. 3974, as amended, be forwarded favorably to the full committee.
All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 3974 as amended is forwarded favorably to the full committee. I now call up H.R. 3989, the Support Our Military Caregivers Act. The clerk shall report.
H.R. 3989, to amend Title 38 United States Code to improve the process for determining the eligibility of caregivers of veterans to certain benefits administered by the Secretary of Veterans Affairs.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with, and the bill is open to amendment at any time. Do any members wish to offer an amendment to this bill? Mr. Bilirakis?
I have an amendment in the nature of a substitute.
The clerk shall report.
Amendment in the nature of a substitute to H.R. 3989, offered by Mr. Bilirakis of Florida.
I ask unanimous consent that the formal reading of the amendment be dispensed with, and hearing no objection, so ordered. The gentleman from Florida is now recognized for 5 minutes to speak in support of his amendment.
Thank you, Mr. Chairman. I appreciate it. Thanks to the members of the subcommittee. Again, thank you for holding this markup today and for considering these bills that seek to improve how we care for our true American heroes. I'm honored to have the opportunity to offer an amendment in the nature of a substitute to H.R. 3989, the Support Our Military Caregivers Act. Before I discuss the substance of my amendment, I want to thank Representative Stefanik, and she's supportive of this amendment. She's a sponsor of this thoughtful piece of legislation. For her, I want to thank her for her advocacy on behalf of those that provide support for disabled veterans. During our legislative hearing, we reviewed testimony from members on their respective bills. The VA and the VSOs, hearing from those on the ground level on how these priorities impact veterans throughout our communities, it's extremely beneficial for the members on this committee. The benefits of authorizing the Family Caregivers Program in 2010 cannot be understated. Very supportive of this bill. Allowing spouses and other family members to care for their loved ones injured in the line of duty provides an environment that enhances veterans' daily living. Although this program was a monumental step in the right direction, we can always work together to find ways to improve how these programs impact the veterans we are entrusted to serve. The amendment I'm offering today simply addresses the concerns that were expressed and highlighted at our legislative hearing from stakeholders and from those who work with veterans on a daily basis. First, it requires the VA to take into account external clinical review findings when determining eligibility for the Family Caregivers Program, should the veteran elect to have such review conducted by an independent contractor. Allowing a veteran to do so strengthens their ability to voice their concerns and how decisions are being made on their behalf. Furthermore, should the VA make a final decision contrary to the supporting documents presented by the veterans, the VA must include their own clinically supported documentation on why such a decision was made. The VA will also be required to issue directives regarding the policies, procedures, and operational requirements in respect to eligibility for the program. This will provide clarification to our veterans and their families. Finally, this bill requires GAO to issue a report on how the VA determines the eligibility requirements to be a caregiver in this program and periodically reevaluate and communicate any changes pertinent to the veteran and their caregivers. In closing, the support given to our veterans through this program is not a benefit, but more accurately a clinical necessity for veterans injured through service to our great nation. As these brave men and women fought on our behalf, we have a responsibility to do the same for them. I urge my colleagues to support this thoughtful piece of legislation. I yield back the balance of my time.
Thank you, Mr. Bilirakis. I will be supporting this amendment. Do any members wish to comment on the amendment in the nature of a substitute to H.R. 3989? Hearing none, and since no other amendments were timely filed, the question now occurs on the amendment in the nature of a substitute to H.R. 3989. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 3989 is agreed to. Since no other amendments were timely filed, the question now occurs on the passage of H.R. 3989 as amended. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it. And I now recognize Ms. Brownlee for a motion on forwarding H.R. 3989 as amended.
Mr. Chairman, I move that the bill H.R. 3989 as amended be forwarded favorably to the full committee.
All those in favor say aye.
Aye.
All those opposed say no. The ayes have it. The motion is agreed to, and H.R. 3989 as amended is forwarded favorably to the full committee. I now call up H.R. 4977, the VA Scheduling Accountability Act. The clerk shall report.
H.R. 4977, to direct the Secretary of Veterans Affairs to ensure that each medical facility of the Department of Veterans Affairs complies with
Bill was
requirements.
circulated in advance pursuant to committee rules, and without objection, the first reading is dispensed with, and the bill is now open for amendment at any point. Do any members wish to offer an amendment to this bill?
I have an amendment.
The
We're going to discuss the
clerk shall
amendment.
report.
It's a very simple amendment. I know we discussed this last week. Basically, all it says is that there needs to be some teeth if these administrators do not follow basically the bill that Congresswoman Walorski's passed. And what it says is a covered official described in this paragraph is each official who serves in the following positions at a medical facility, the department during a year or portion thereof for which the director does not make a certification under the subsection. This will apply no bonuses to the director, the chief of staff, the associate director for patient care, and the deputy chief of staff. In other words, there won't be any bonuses going out to people when they ignore these policies. And that's the thing I've seen since I've been here, the 7 years, is that we pass a bill and there's no teeth to it. and therefore they just keep doing what they're doing. So this puts some teeth into Congresswoman Jaworski's bill. I yield back.
All right. The clerk shall report the amendment.
Amendment to H.R. 4977, offered by Mr. Rowe of Tennessee.
I ask unanimous consent that the formal reading of the amendment be dispensed with, and hearing no objection, so ordered. Thank you for your amendment, Dr. Rowe. I will be supporting this amendment. Do any members wish to comment on the amendment to H.R. 4977? Hearing none, and since no other amendments were timely filed, the question now occurs on the amendment to H.R. 4977. All those in favor say aye. Aye. All those opposed say no. The ayes have it, and the amendment to H.R. 4977 is agreed to. Is there any more discussion on the bill as amended?
Mr. Chairman?
Mr. Hillskamp.
Hey, Mr. Chairman, I don't have an amendment that's not related directly to the bill, but I would like to draw attention to the subcommittee that an OIG report was released about falsifying data on the benefit side. I know this is dealing with medical facilities, but in the Wichita VA Medical Benefits Center, they were instructed to enter false data that shortened the apparent time in which they were waiting for their appeal to process. So this has just come out in the last couple days. I just want to bring that to attention of the subcommittee to suggest that it looks like we could have a problem just not on the medical side, but on the benefit side as well. So I have working with the committee and Office of Inspector General to figure out what our next steps might be on that. So bring that to your attention. I appreciate and do support this bill. Hopefully we don't need it on the other side of the VA as well, but I fear we might. So I yield back.
Thank you, Mr. Hillskamp. We'll certainly follow up. Since no other amendments were timely filed, and the question now occurs on the passage of H.R. 4977 as amended. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 4977 as amended is agreed to, and I now recognize Ms. Brownlee for a motion on forwarding H.R. 4977 as amended.
Mr. Chairman, I move that the bill H.R. 4977 as amended be forwarded favorably to the full committee.
All those in favor say aye. All those opposed say no. The ayes have it, and H.R. 4977 as amended is forwarded favorably to the full committee. I now ask unanimous consent to consider H.R. 2460 to improve the provision of adult daycare services for veterans, and H.R. 3956, the VA Health Center Management Stability and Improvement Act, in block. Hearing no objection, so ordered. The clerk shall report.
H.R. 2460, to amend Title 38 United States Code to improve the provision of adult day health care services for veterans.
The bills were circulated in advance pursuant to committee rules, and I ask that the reading of the bills be dispensed with. Hearing no objection, so ordered. Is there any discussion on the bills remaining on the agenda? Since no amendments were timely filed and hearing no comments, the question now occurs on the remaining agenda items. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it. I now recognize Ms. Brownlee for a motion on forwarding our remaining agenda items to the full committee.
Mr. Chairman, I move that the bills en bloc be forwarded favorably to the full committee.
All those in favor say aye. Aye. All those opposed say no. The ayes have it, and the remaining agenda items are favorably forwarded to the full committee. In summary, subcommittee has voted to forward the following 7 bills favorably to the full committee: H.R. 353 as amended, H.R. 3471 as amended, H.R. 3974 as amended, H.R. 3989 as amended, H.R. 4977 as amended, H.R. 2460, and H.R. 3956. My sincere thanks to all the sponsors of the bills and the amendments that were considered this morning, and to all of the subcommittee members, especially Ranking Member Brownlee, for their work here today. Thank you for being here. Without objection, the subcommittee staff is authorized to make any technical, clerical, and conforming amendments as may be necessary to bills favorably forwarded to the full committee. Hearing no objections, so ordered. A meeting is now adjourned.
Mr. Chairman, just briefly, I just want to report to the subcommittee that I had an opportunity to view a documentary that features our chairman, Chairman Miller, and the event was co-sponsored by Earl Perlmutter and our committee colleague, Mike Kaufman. The documentary was called Acronym, A Cross-Generational Battle with PTSD. I highly recommend that either the committee or each of us individually take the time to view the film. It was incredible and highly informative about PTSD and the struggles and the many groups out there that are working on the topic. So since our committee members were involved, I highly recommend we do something about it. I saw it at the theater, and if we talk to Mike Kaufman, I bet you we can get copies of it, so great.